Today is American Diabetic Alert Day, and I'm going to speak to you today about diabetes. Diabetes is a disease of your endocrine system, which involves your ability to use sugar in a normal way in your body. There are three types of diabetes present, and the first type is type 1, which affects mostly children and sometimes young adults. And it is an inability to produce enough insulin to be able to handle sugar in your body. There is a type 2 type of diabetes, which is the most common. And that type of diabetes is mostly involves adults, and it involves the rise of sugar in your body so that we don't know why, but you just can't produce enough insulin to handle that. And then there is a gestational type of diabetes that occurs when you're pregnant. Women who have this type of diabetes will have an increased risk as they get older to have problems with diabetes. Diabetes is a very big problem in our country. We had 1 million people 20 years ago. We now have 25 million people affected. It is associated with our epidemic of obesity. The risk factors for diabetes are multiple. Genetics is one. So if you have a family history, or if you come from an ethnic group that is Hispanic, Native American, or Afro American, you have a higher risk to have diabetes, as high as 15%. The other component to this is your eating habits and your weight. So it is associated with obesity, and it is associated with lack of exercise and what we eat. So these are two areas where we can actually make an impact on trying to decrease the risk for diabetes. There are multiple ways to test for diabetes, but if you feel that you may be at risk, or if you have further questions, it would be very useful for you to contact your physician or to go to the link that we're going to have associated with this message that will allow you to test yourself and see what your risk factors may be and what further steps you need to do. Thank you very much.